This conference will now be recorded.
Okay. Thank you. Dawn, thank you for joining us today. Really appreciate you being here. Dawn Oki Gartman is the State Director for the North Carolina Project Care. That is the only state-funded dementia-specific support program for unpaid family caregivers of those living with Alzheimer's disease or related dementias. Project Care is a coordinated system that is responsive to the needs, the values, and preferences of families, which follows a structured care consultation approach and offers respite vouchers to eligible caregivers based on available funding. In addition to 5 years of experience at the NC Division of Aging and Adult Services, Dawn has worked with the Family Caregiver Support Program and other home and community-based services since 2007. Primarily with the Central Carolina Area Agency on Aging and Randolph County Senior Adults Association. Dawn holds a master's degree in gerontology and a post-baccalaureate certificate in nonprofit management from the University of North Carolina at Greensboro. Her undergraduate study was the field of psychology at the State University of New York at Oswego. Dawn, I'm sure I messed that up.
Oswego.
Yeah. Dawn, we are so happy to have you join us today. Thank you for taking the time to be here and share with us what some of our resources are in our community. I'm going to hand it over to you and we'll get started. Thank you, Dawn.
Thank you so much. This is a perfect time to start, thinking about family caregivers since November is National Family Caregiver Month. And it's time to recognize and acknowledge all the contributions our families make in caring for their loved ones, but also to encourage family caregivers to practice their own self-care in order to maintain their personal health and well-being. And I hope, to make this presentation pretty, flowing easily and helpful for you, but know that we're always available for additional questions here at the state. So the objectives of this webinar today are to really, again, like I said, recognize who are our family caregivers, finding some of the obstacles that older adults and their families face in finding help, learning about the North Carolina Division of Aging and Adult Services Caregiver Support Programs. Predominantly, we'll be speaking mostly about the Family Caregiver Support Program and Project Care, which I work with, Caregivers Alternatives Running on Empty, which works specifically with caregivers of persons living with some form of dementia. And we're going to explore some of the community resources that might be available to older adults and their family caregivers. Let's start the discussion on what is caregiving first off. In essence, it's looking after another person's health needs and well-being. Most commonly, we relate to assistance with activities of daily living, the ADLs, or the instrumental activities of daily living, or what we call the IADLs. Well-being is a combination of factors, including emotional, social, and financial constructs. And caregiving activities, of course, include providing emotional and communication supports, coordinating another person's care, and ensuring their safety. And of course, managing health conditions. And a lot of times that's with medication management also. Some of the examples of caregiving that family caregivers deal with, is beyond really the difference of what a family friend does as compared to what a caregiver does. And you need to recognize what those particular tasks might be that are in addition to what a family does, say a caregiver, spouse, daughter, son, partner, sibling, friend. So again, it goes beyond assisting, again, with the IEDLs, more than what you've done before. It's more than just, it is, of course, taking care of some of the shopping needs and transportations and paying for bills, which we normally would do with older adults. But caregiving takes on a little bit more role when you're the person, when the caregiver is the person who has to coordinate that and do all that and really kind of direct or possibly supervise the care recipient. And working with NC PACE, and everyone I'm sure is aware of all the ADLs that a care recipient might have. And you have to realize caregivers, family caregivers, they don't come with all those skill sets. They don't come with nursing backgrounds and medical backgrounds, you know, and having to learn how to deal with assistive devices and what are they used for, and really discover what they do and how to use them. You know, a older adult could get sent home from their healthcare provider or possibly the hospital and discharged, and the family does not know how to properly care for them. So they have to learn how to provide that care at home while there's not a professional around to do so. So it's taking on a lot more responsibility, a lot of learning curve, and that role that they take on, and understanding, probably learning another whole set of language based on the healthcare needs of the care recipient. So really, who are those family caregivers? And I think if you just look personally at your own situation, your own family, you know, and think of who might be the caregivers that you're surrounded by and who are caring for people within your family network or neighbors. Most typically, it's a middle-aged woman, daughter, caring for her own family, possibly most prominently her parents. A lot of them also are spousal caregivers, who we normally would expect. Again, the roles that people normally play in their families. 83% of the help provided by family caregivers really comes from their family members. 44% of caregivers live actually with the person that they care for, again, because of those close familiar roles. And about 1 in 3 caregivers is the age of 65 and older, which says a lot about our longevity, how long we live, and that a lot of it is spousal, but at the same time, it's not uncommon to have a 60-something-year-old adult child caring for, you know, their 80 to 90-year-old parent. So why do caregivers provide that assistance? And, you know, there's 3 key things that came out of the Alzheimer's Association. I'm going to be quoting this source for several slides here, because it's the work that the Alzheimer's Association does and on caregiving and providing this information has been historical, and they update their figures every year, and it's always a good resource. But again, going back to why do caregivers provide assistance? And most common, you know, 65% is because of that desire to keep a family member or a friend at home. That is predominantly the most common. Others, it's having that close proximity to someone with dementia, having that relationship and having that continuing care that you've done probably for most of your life. You're just not going to let that person, you know, live unsafely. And then, of course, that perceived obligation to the person with dementia. If you're a long-term family member, your daughter or son, you feel obligated to care for another family. The same thing with possibly your siblings. And it's not just for older adults. When you see this all the time across the lifespan, that there's this familial obligation to go ahead and provide care to those that we love in our family. And since I work with Project Care, and we work specifically with caregivers of those with dementia, and a lot of my information here is going to be quite dementia related. Let's just go over really what dementia is. And I probably don't need to tell most of those that work in the NC PACE network what really it is, but it's simply, you know, the loss of cognitive functioning, thinking, remembering, and reasoning, and the behavioral abilities to such an extent that it interferes with a person's daily life and activities. And dementia ranges in severity from the mildest stage, when it is just the beginning to affect a person's functioning, to the most severe stage, when a person must depend completely on others for basic activities of living. And there are hundreds of different types of dementia. And dementia could be caused by simply, dehydration, and medication also. But the diseases that, such as Alzheimer's or Lewy body or frontal temporal lobe, those are the ones that are very concerning because they're progressive. People are not going to get better. There's no known causes or no known therapies or treatments for, not treatments, no known treatments that will go ahead and reverse the disease. So caregiving could be a very long career, as you might say, for family members or for friends, partners. But again, these are some of the interesting stats, what I look at and thinking about what can we do to help family caregivers. And when you think about it, little less than half of all caregivers of older adults are caring for someone with some form of dementia, just a little under a half of all of them. And so some of the stats is really interesting when you look at North Carolina. Of those age 65 and older, the Alzheimer's Association projects that by 2025, an estimated 210,000 North Carolinians will have Alzheimer's disease, and that's a 16.7% increase from 180,000 persons in 2020. So we're talking a 5-year span. Likewise, Medicaid costs are projected to increase 22% during this 5-year period for persons with Alzheimer's disease, with $1.332 billion in costs for 2020. Medicare costs for people with dementia averaged $24,737 per capita spending in 2020. And in North Carolina, much of the care, as everywhere, much of the care is provided by an estimated 358,000 unpaid family caregivers, with a cost valued at $7.3 billion in 2020. Now, the Alzheimer's Association also reported that 1,082 more deaths in 2020, or 11.3% higher than average during the COVID pandemic. And we've heard stories about that within the last year and a half, and how vulnerable our populations are, older adult populations are, to COVID-19. The cost of healthcare and long-term care services for individuals living with dementia is substantially higher than for those living without dementia, which adds an additional financial burden to the already physical, emotional, and social challenges families encounter with dementia caregiving. Just like about any other disease, people don't like going to the doctor right away, right? So there are many cases that go underdiagnosed or underreported. Some of that is due to just the denial that they actually have an issue, that they have challenges dealing with their mental capacity and their cognitive health. 1 in 9 in people in age 65 and older has Alzheimer's dementia in the U.S. And we know that's less common in those younger than 65, but as the chart says, as you get older, so does the prevalence. And particularly when, oops, I didn't spell that right, particularly those 85 and older, I mean, we're a little more than a third of older adults, 85 and older, experience some form of dementia. When you think about it, what do you think would be some of the obstacles that family caregivers experience when they're first recognizing that they are caregivers, but then also finding, resources in the community. The first thing I mentioned earlier already was that denial. A lot of families are in denial that there is a problem that exists.
So Dawn, as the executive director for the PACE Association, I receive a lot of phone calls from family members trying to find help for their family who are in need of services. And one of the biggest things that I find, especially in the rural areas, is there, as you've got on your list, lack of resources. There's just no help out there in some of the communities across the state.
And I can't, I've been working in the field for, a good number of years, and I've seen that directly also. First, it starts on an individual level of really recognizing that there is a problem or that we need help, that it's a role, something beyond what we normally do, and we need that help. But then there's also the financial cost that's involved, as I mentioned in the numbers earlier, which is extensive when you think about it for any family to bear those costs. Also, caregivers don't have a lot of emotional support. Some people have a very hard time asking for help. We get calls like this all the time, and by the time we get their calls, it's a matter of they're in crisis, what we call a caregiver in crisis. They're emotionally exhausted, stressed out, don't know what else to do, and especially some of those working caregivers. It's hard to listen, but sometimes that's all you can do is just listen, and they need to vent, and then work through what are the top things that they really are looking for supports on and really could use that help. But as you mentioned, Lynette, the lack of resources, every county is going to be a little bit different. You get to the larger metropolitan areas, and of course, there's a lot more support there, but not necessarily they're there, but there could be extensive wait lists for some of these services. And I just have to applaud the PACE associations and all their organizations and affiliates is the wonderful work that you do provide for much more holistic approach, because typically a lot of family caregivers do not have access to those resources. And that's why the services that we provide through the Division of Aging and Adult Services really are aiming to help those caregivers, find the resources and solutions to help them in their new role. And again, thinking about the caregivers themselves and what they're going through, the stress, the burden, depression, besides their other family obligations, because a lot of them are also caring for their own families, in addition to possibly caring for another adult. So I wanted to talk to you today about a couple of the programs that we have, really two key family caregiver support programs. And I'm going to mention supports for the Home and Community Care Block Grant, and some of the services that are provided through that Older Americans Act type funding. But I'm going to have to just extend that these services aren't not necessarily available to Medicaid persons receiving long-term care services and supports through Medicaid. By far, those that are receiving services through long-term care services and supports are getting a whole lot more services than they would through the existing Home and Community Care Block Grant funds, which are very limited. We've gotten a lot of extra funding in the past year or so just due to the COVID and recognizing the challenges folks have in trying to stay safe. But there are still services out there that could support family caregivers of those that are within the PACE program. But also, if we find that they're not eligible for the PACE program, these would be good resources for them to be referred to. So I want to talk first about the program that I oversee. Project Care is a state-funded dementia-specific support program for individuals who directly care for persons with Alzheimer's disease or related dementia. Project Care utilizes a coordinated delivery service system that is responsive to the needs, values, and preferences of unpaid family caregivers and is administered through the DHHS Division of Aging and Adult Services. Oops, excuse me. You know, we've been operating, Project Care started a long time ago, 20 years ago, with some federal monies under a Alzheimer's disease demonstration grant from the federal government, and working with various different models. Project Care has really transformed itself over the years, and most definitely has transformed itself since October 2016, when our General Assembly went ahead and provided funding to Project Care to expand the services. We used to have, prior to October 2016, we were in about maybe 36 counties of 100 counties within the state. We were able to double the regional offices from 3 to 6, and we're given an opportunity to provide respite. We had received respite funds from the federal government. We were under the demonstration model, but that all stopped really in 2014. But now we have reoccurring funds from the state level. And we work with our partners to address the quality of life needs and well-being for all older adults, but particularly those individuals with greater challenges and higher level of needs. The key goal of Project Care is to provide services for dementia caregivers, enabling their care recipients to age in place or to delay or avoid unnecessary placement in long-term care. We operate with a family consultants model where they provide support directly to family caregivers of persons living with dementia by offering caregivers consultation services. And basically that's dementia-specific information, we do a caregiver assessments, and help to develop individuals' care plans, along with providing caregiver education and connections to social supports and networks. And it's really on that one-on-one basis is working with the family consultants. A lot of times before COVID, most of the consultants would go out and visit families within the home to get a really better picture or assessment of their needs and the environment they're in. And since COVID has hit in the last year and a half, working mostly telephonically, and that in itself has brought some additional challenges. So again, one of the key things is linking families to available community resources to address unmet needs, including local support groups, supportive services. You know, we screen for entitlement programs and make recommendations or referrals to other community resources. And again, one of the things we do screen for is eligibility for Medicaid right off the bat, just to see if they're, you know, if that would be a service that could help them. And the PACE organizations are constant referrals for us if we find that someone could be eligible for that service in that specific area. And again, we also partner with the area agencies on aging across the state. There's 16 of them, and through its family caregiver support program, which I'm going to talk about next, to provide outreach, training, and education. Again, our family consultants are very much specifically trained on dementia. So they're able to provide a little bit more professional support specifically with those caregivers. One of the things that our program also does is provide family caregivers with vouchers, respite vouchers, whereby the caregiver actually decides who, when, and where they're going to hire help. When you think about the amount of service that some of the programs and the value that the care recipients and their families receive from a PACE organization to what we can provide for families that are not eligible for those services, this is why we're there. And unfortunately, we just don't have an awful lot of dollars, but we provide the supports whatever way we can in trying to address the needs of the families. We also provide training and assistance to the AAA and the community at large to increase the capacity to assist persons with dementia and their families. Here's just a quick glance of our current partners. And Project Care is a relatively very small program. We have funding for 6 family consultants that cover 100 counties. And again, we can only do this by partnering with other organizations and working with them. And so again, one of the eligibility criteria is that the person with dementia has actually received some kind of healthcare diagnosis, because we still have wait lists for our programs too. There's a lot of care, there's a lot of need out there. So just to give you a little bit of the impact that we had for this very small program for 2021, we operate with limited flat funding. So that means, the cost of care goes up, but that doesn't mean we get more dollars to spend. It just usually means we are not able to serve as many caregivers or provide as much respite. So in 2021, our 6 family consultants served 572 non-Medicaid family caregivers for consultation services. Of those, 484 had been awarded at least 1 respite voucher. And again, they can get up to 3 per fiscal year. And 66% of the caregivers receiving respite were new to Project Care. And as I mentioned earlier, we screen for other services and make referrals. So pretty much year after year, about 2/3 of our population, or 2/3 of the caregivers we serve, are new to the program, and we introduce them to other community-based services. A lot of them are those home and community care block grants services, but they're also quite frequently in helping those caregivers, plan for the future. And that is, like I said, very, very frequent. And what do they do when they can no longer care for their loved ones? So a lot of times it's talking about possible facility placement. 52% of the caregivers just received 1 $500 respite voucher. It's not a lot of money, but it does provide some relief for the caregivers so that they can do things to practice their own self-care. And it's not just so they can, take a break. We really encourage caregivers to go ahead and have a break for themselves, doing something they normally wouldn't do. Quite frequently, we see caregivers actually being able to take a few days off, maybe to go attend a family wedding or grandchild's graduation, or other family type of events, because they just can't leave the caregiver or the care recipient, as you well know. We've been able to reach this past year also 97 out of 100 counties. And again, at the end of the year, we still had 133 caregivers waiting to enroll in our small program. And again, most of the time it's word of mouth. When we did the expansion into the, across all 100 counties, we had to do a little bit of outreach to start with. But working with the area agency on aging, we don't do as much outreach because it's all word of mouth. They hear about Project Care and the good work that we do. And we seem to get a steady stream of referrals for our program. So let's move on over and talk about the National Family Caregiver Support Program, which is about the same age and been around the same time frame as Project Care. It's a national program, comes out of the Administration of Community Living, and is part of the Older Americans Act, which provides a lot of those fundings for the home and community care block services, which we'll get into. It recognizes the critical role families play to support older adults and those living with dementia through challenging health and functional situations. And since it's federally mandated, I mean, we have 16 area agencies on aging within our state, and every state has area agencies on aging. It's mandated to do so. Some states, some of the smaller states, it's like one area agency on aging, such as in Wyoming, and others it's, you know, the area agency could just be within one county or municipality that are really large. So again, it depends on the state as to how they go ahead and provide the supports and how they go ahead and have it administered. So we utilize the regional council of governments or regional councils to go ahead and operate through them. So there's 5 main really themes with the Family Caregiver Support Program and reaching out to supporting families. First, of course, is the information to caregivers about available services. And by the end of this presentation, you will know that you need to contact an area agency on aging if you're looking for specific services or anything in general. So they offer information to caregivers about available services. They provide assistance to those caregivers also in gaining access to services. They have the capacity to provide individual counseling. They offer support groups or refer to support groups, and also training to assist caregivers in the area of health, nutritional, financial literacy. And again, as I mentioned earlier, there is also a significant amount of their funds that will go for respite to help relieve the burdens of family caregivers so they can practice their self-care. And again, this is not something that the respite and supplemental necessarily would be available to PACE caregivers, but definitely information on support groups and training. A lot of them sponsor in partnership with other organizations, different training events. You might see caregiver colleges or seminars or different workshops out there regarding caregiving. A lot of times it's the Family Caregiver Support Program that's co-sponsoring or actually facilitating that. And as Lynn had mentioned earlier, specific services are going to vary by county. They're going to vary by region, but they're also going to vary by county because they need to work in conjunction with what's available in those areas. Whoops, sorry about that. Okay. And like any federal program, there's always, criteria and standards that need to be met. And so basically with the Family Caregiver Support Program, it's serving a caregiver of any age that is caring for someone age 60 years and older, or someone providing care for someone who's Alzheimer's disease or related brain disorder, because we know that affects also people younger than 60. Another interesting component of the Family Caregiver Support Program is that they also provide caregivers age 55 and older who are raising a child, age 18 and under, or actually an adult with a disability. And it's not uncommon to see an older adult still caring for their adult child who has special needs or disabilities, as they age. So the 16 area agencies on aging, here's a quick little map. And again, services are going to vary within those regions. Some of the smaller populated rural regions, such as out there on the Northeast or way out in the western portions of North Carolina, very rural areas, some of those area agencies on aging actually coordinate the services and supports, such as the nutrition program, say, within by their agency. But a lot of them also will contract out specifically. Much more of the bigger metropolitan areas will work much more closely with their county partners or county designated agencies that will network with them to provide the support services. And again, Family Caregivers Support Program is a program embedded in the Area Agency on Aging. I was very excited to be asked to talk to you today, because one of the things I've been working on was a new service, and this would be available to PACE family members, is this new North Carolina Caregiver portal. It's an e-learning service for Project Care and FCSP caregivers. And we got some special funding from out of the ADRC No Wrong Door COVID-19 relief funding that came out of the CARES funding in 2020. And part of the objective we submitted in with that grant was to develop, enhance, innovative services or service structures. You know, North Carolina traditionally across the state had been doing, you know, workshops face-to-face and holding events and conferences for caregivers in person. And we knew, we've known for a while that we've not been able to reach a lot of working caregivers. And so this was an opportunity to go ahead and expand some of, to expand our trainings available and actually do so in a manner that would be comprehensive across all 100 counties. You know, the purpose of this grant, the purpose of the portal, let's say, it's twofold. The first fold is really helping family caregivers, empower them to safely and confidently continue providing care at home. And again, that's where care is most provided. Caregivers need access convenient to their personal schedule, hence the on-demand format is given, the content that is presented in short snippets. The training journey through the portal, through the coursework, is very much personalized and self-paced, providing relevant content for the user. And it's also connected. We also use it as a resource to connect caregivers to state and local resources and services. And that was one of the key components that when we were looking at a system, is having a little bit of multiple function to be able to provide the educational piece, but then also to be able to provide resources for caregivers to find within the state. And since we had been looking at something for working caregivers prior to COVID, this was just a perfect fit for everyone who, you know, when COVID started hitting, as to what we can do to move forward and work with it. The other purpose with initiating this program, this service of the caregiver support programs, is really thinking about the aging network. And as I mentioned, most of the trainings have been face-to-face, which means setting those events up, finding speakers, getting everything done, you know. And again, it's different from one county to the next county. And so benefits to the aging network and our providers was really having a much more newer, innovative service delivery model that they could go ahead and utilize to family caregivers regardless of where they live. The portal provides one more tool which expands and enhances the education and training options already offered by our partners. And registration into the portal is quick and easy, and it aligns nicely with the existing program and service registration for both the Project Care and Family Caregiver Support Program. Again, as a state unit, it brought a significant cost savings to be able to do it across the state versus traditionally this would have been something that each of the area agencies on aging or counties would have gone ahead and moved forward to. But this way we have a succinct service across available to everyone. So once a caregiver is registered on and onboarded in the portal, training occurs without staff having to devote a significant amount of time and energy. giving them more time to work on other things. The system will provide us, and obviously the system will provide us here at the state the capacity to survey caregivers and evaluate their engagement. One of the, early on in the exploration of service vendors, we wanted to find an evidence-based or evidence-informed model. And given the novelty of the technology, targeting caregivers concerned, it was difficult to find comparative systems. And the one that we came up with is Trulta, and enjoyed, the results of this study that is just coming out in the Journal of Alzheimer's and Dementia, where they studied, they wanted to go ahead and help improve caregiver confidence and reduce stress during a 30-day intervention, whereby the caregivers viewed actually 33 models on average and spent 8 hours on the platform. And some of the results were the 32% increase in fulfillment from caregiving. We're talking 30 days. In 30 days time, a 32% increase in fulfillment from caring, 14% improvement in the ability to manage care, and 14% to increase confidence, 12% improvement in patient well-being, and 10% stress reduction. And of course, the content that's in here that we find really valuable is across different domains. And again, the caregivers and our caregivers are our clients. It's not necessarily the care recipient, it's the caregivers themselves. And so looking at the caregiver's wellness, and also, as we mentioned early on, the safety and injury, ensuring safety and injury at home is really important to caregivers. So there's modules on that. Brain health keeps coming up as a hot topic, and specifically on some of the caregiving tests. And then there's also a music component within the current coursework. One of the other beauties with working with Trulta on our caregiver platform is that we're able to have new content added. And so most recently, they've added diabetes, started with social isolation, and they're going to have some IDD caregiving coming out soon too. So again, some of the topics really quickly for caregiver wellness is, which is again one of the most popular topics, caregiver wellness. A lot of them we'll see caregiver guilt, relax and unwind, assert yourself and ask for help. And again, the anger and frustration, really dealing with the caregivers themselves and what they're enduring. Brain health is such a variety of topics within brain health. And again, this platform originally started with dealing with dementia and caregiving, but it is expanding to other areas of education. But there is an extensive amount of modules and courses work on brain health, communication, assisting with functional needs, sensory stimulation, living with a purpose, including loved one with daily tasks, and understanding behavioral change. And I know, the PACE staff are very well trained, but when the families that care for them at home, they still need a lot of training. They still need a little bit of information on how to deal with certain things. And again, these are generally 5 to 10 minute snippets, but we do have some much longer videos on there. And again, as I mentioned, safety is a big, huge domain. And there's such a variety of different topics, even down to dementia-friendly interior design, and of course, moving and transferring, safety tips and caring. The portal also has has gotten work from TIPA Snow, and there's quite a few videos from TIPA Snow on caregiving. And again, they could last up to 2 hours. In fact, we just had a special webinar with TIPA the very end of October. She did something for the caregivers who were involved in the portal. So this is kind of what our caregiver portal looks like. And if I just, let me see what I need to do. I wanted to, oops, back. This is what our homepage looks like. And it's very simple to get in to use. A caregiver is actually invited by one of the staff persons working through Project Care or the Family Caregiver Support Program. And they work with them to get them registered, but then also to kind of guide them through initially to the program and also make recommendations. But as you can see, we have information on North Carolina resources. Then there's some hot topics that come up. Resources also are on there, such as the Operation Medicine Drop. And here's just a couple snippets of what some of the other topics are, like grief and loss, activities and recreation. Again, we have our dementia expert, TIPA Snow, and you'll see some of the coursework that we have under her groups. And what's interesting, working with this platform, we're able to track what are the common topics that our caregivers are most interested in. And that also helps us to inform content development and also events, and being able to try to sponsor those and facilitate those resources within the platform. But as you can see, brain health is at the top, as is caregiver wellness. People really have enjoyed the TIPA Snow videos in the platform also. So the third thing on that list of resources was, the Older Americans Act Home and Community Care Block Grant. Again, Older Americans Act is a funding source we receive from the federal government to provide some really basic services to older adults aged 60 years and older and their family caregivers. The priority group that we work with is those really targeting those older adults with the greatest social and economic need, to older individuals, providing care to older individuals who provide the care to those with severe disabilities. So really trying to serve the underserved. And when I say that, serving the underserved and dealing with programs such as the Medicaid long-term services and ports and PACE, most of our clients that refer to us really are just not eligible for Medicaid. A lot of them make, $5 to $20 over the income limits. But that doesn't mean that their families, don't have the same needs. It's just trying to find services for them is a little bit more difficult, and being able to provide things such as the different types of services through the block grant, we needed to have an avenue for them. So quite a few of these services probably are not going to be eligible for PACE program participants and their caregivers. However, in case there's somebody who is looking for services and then we determine that they're not eligible, they would be, possibly referred to the Home and Community Care Block Grant and really go back to those area agencies on aging. So the types of services funded would be things like the adult daycare, the nutrition programs, which are both congregate and home delivered meals, in-home aid services, which have a huge wait list because people age in place for quite a while and they need those services ongoing year after year. Same thing with the home delivered meals, which also has a wait list. Again, we offer that information and options counseling. There's some counties will go ahead and offer housing and home improvement. And there's a handful that do care management. And I believe we have one overnight respite provider that we use that is using home and community care block grant. And how are these services really determined? It goes back again to the county level. Every county, since there's usually a match, it's federal dollars with a state match and a local match. So usually there's a county aging planning committee that makes determination every year of how much money will get allocated to the different services. Most common are going to be those nutrition services, the in-home aid services, transportation services, and then adult day services. Those are the most common throughout all 100 counties. But again, we do have counties that don't have things like adult day. But the other three, pretty much there's some provider within those counties that provide those services. So going back to, PACE families, going back to the PACE families and what kind of services that we can provide, it's really the general caregiving information and education. And again, that's one of the reasons, for developing the caregiver portal is trying to find another way to provide that education. But there's also, support groups out there that we can make references to. And then definitely the AAAs and the local providers' advocacy towards families to build services around them. Support groups you're going to find everywhere. I mean, the area agencies on aging always has listing, and some of them are also facilitating support groups, especially within the family care group support program, but also with other different aging network partners. And it could be a county Department of Social or county Department of Social Services. It could be a county division or Department on Aging or Council on Aging. We also work very closely with faith-based groups. We'll do a lot of support groups. And of course, all the different types of disease-specific organizations usually have some kind of support group network that they can provide information on. And with, the whole thing with COVID, a lot of them have gone into a virtual support group or telephonic support group so that services can be delivered. Again, there's a lot of resources out there for older adults and their caregivers. Again, the area agencies on aging. There's the United Way 211 that provides general, really basic services. Social Serve is a nonprofit organization that really is nationwide, but it provides information on housing, specifically affordable housing, subsidized housing. So it's a great place to look. And of course, just Googling information. There's the benefits checkup out of the National Council on Aging. There's also, again, those disease-specific information. And just to say, they have a vast amount of supports available to them too. And I know specifically like Dementia Alliance, they have a dementia navigator, so to help persons. And again, a lot of our referrals are also to Medicare, to the SHIP counseling and training, Social Security, and the VA support also, which has unique programs. And one last thing I wanted to refer to, because I alluded to it earlier, as caregivers plan for the ongoing training for their family members and loved ones, is the Regional Long-Term Care Ombudsman. These are federally mandated. It's a federally mandated program, and each of the 16 area agencies on aging has at least one long-term care ombudsman, and they act as liaisons for residents in long-term care facilities. So when I get a family that is planning for long term or possibly in the near term, and they're looking for, I can't take care of so-and-so right now, I can't do it anymore. You know, what is the steps to do, and how do I find funding, or how do I pay for, or, you know, how do I even start to look to find out what, you know, what is the next step? And a lot of times I'm referring them back to their agency and aging to a long-term care ombudsman, because they're very knowledgeable about the different levels of care and also paying for those cares. And they also facilitate resident rights and also conduct community and facility staff training. So again, the biggest thing I wanted you to take back from this when you're thinking about finding resources for family caregivers of your participants within PACE programs is really reaching out to the area agencies on aging, the whole network. If you don't have them in your Outlook contents or whatever you use, I would definitely find your local area agency on aging and get connected with their staff to be able to find and make those referrals for your caregivers. Besides, they do offer a lot of good training also to providers a lot of times within the community. So kind of as a summary, there are supports out there. And again, the Division of Aging and Adult Services, we really work with those through the Older Americans Act money, predominantly through those that just are above the poverty guidelines that are not going to be able to be served by Medicaid, but really helping them to find supports as they work through their issues and finding some manners of what they can do to support themselves, but also to support their family members. And remember that public funding is always limited with our programs, and so there might be some wait lists. So I know we're kind of running up on time here already, and wanted to know if anybody had any questions.
Dawn, thank you so much for joining us today. We really appreciate it. This presentation is recorded, so it will be on our website for those who could not join us but would like to review it. Thank you for sharing some of the new programs that you guys are working on. I really look forward to hearing from the PACE staff about the Caregiver portal and how that works, and if that's of benefit to our participants and their caregivers. If there are no other questions or comments, we will end today by telling you again, thank you for joining us. We really appreciate it. And we look forward to continuing the conversation, Dawn. Thank you so much.
Well, thank you for inviting me. And again, I put up the contact information. We do have a caregiver navigator number, 800 number too, if folks have a question, or if you want to send those caregivers to us also. We can direct them as to where they might look. So contact our caregiver navigator line. Thank you. All righty.
Okay, guys, have a great rest of your day and rest of your week. Thank you so much. Bye-bye.
Bye-bye.
Oh, Deborah, did
That
you have a comment?
very informative. Thank you.
Okay, thanks, Deborah. All right. Bye, guys. See you later.
Bye-bye.